Smith-Magenis syndrome. What is Smith-Magenis syndrome, or SMS? This syndrome was first described by Anne Smith, a genetic counselor, and Ellen McGinnis, a physician and chromosome expert. SMS is considered a low-incidence disability due to prevalence and differences in both physical and behavior development. SMS affects 1 in 25,000 individuals. However, most researchers believe that SMS is underdiagnosed and may be closer to 1 in 15,000. Clinical diagnosis and testing is based on physical characteristics and distinct observable behaviors and is associated with a microdeletion involving chromosome 17. It is usually not inherited. In rare cases, SMS can occur from a gene inherited by a parent. Here are physical characteristics. Brachycephaly, or a disproportionately short head, broad face, and nasal bridge, flat mid-face, posteriorly rotated or low-set ears are present. Upward slanted eyes, prominent jaw in older children and adults, short stature, abnormalities of the palate with or without cleft lip, downward turned mouth, short fingers and toes, short, broad hands. Here are differences in health development. Low muscle tone and feeding problems occur in infancy. Chronic ear infections and hearing impairments. Eye problems like strabismus, eye alignment, and myopia. Heart defects and murmurs. Urinary system problems. Scoliosis. Unusual gait or walk. Here are cognitive and communication development differences. Studies indicate the majority of individuals have moderate cognitive impairment. At least one research indicates strengths in long-term memory and visual attention. Speech and language delays are present. Individuals tend to ask the same questions over and over, like, where are you from? Or what is your name? It is important to note that some individuals never show significant behavior problems. Some observable behaviors may be seen, such as hyperactivity, sleep problems, self-hugging. Self-hugging involves involuntary tick-like movements consisted of crossing both arms across the chest and tensing the body or clasping the hands and squeezing the arms to the side. They may show aggressions, self-injurious behaviors, head banging, hand biting, pulling out fingernails and toenails, insertion of foreign bodies or objects into bodily orifices, insensitivity to pain, stereotypic or repetitive movements such as spinning or hand flapping. Autism spectrum features may be present. When looking at social development, individuals are described as loving and caring, eager to please with a good sense of humor. Social skills are relatively a strength. They enjoy adult attention. Infants have easy temperaments. With age, individuals may have frequent temper outbursts. Some show attachment to particular people. Smith-Magenis syndrome has an impact on all 8 quality of life domains. The domains are emotional well-being, interpersonal relations, personal development, social inclusion, physical well-being, self-determination, material well-being, and rights. Support teams, which include and not limited to speech and language pathologists, teachers, parents, psychologists, and nurses, all identified staff need to consider all 8 domains. More importantly, the individual with SMS should always be included in discussions, goals, and plans. When having discussions about emotional well-being, interpersonal relations, personal development, and social inclusion, teams should address challenging behaviors like aggressions and self-injurious behaviors. Teams should also support students' strengths in these areas, such as having an affectionate disposition or a strong sense of humor. Concerning physical well-being, teams should carefully monitor health, like vision, hearing, and heart. When discussing self-determination, individuals with SMS should be provided with instructions and should be provided personal, meaningful choices in the area of personal goals, personal control, and self-direction. They should also be given opportunities to have possessions and employment to support material well-being. They should also have instruction in increasing self-advocacy skills and knowing their rights. What is the impact on the family? Taking care of a loved one with SMS may be challenging for families and may cause emotional stress for both parents and siblings. Some areas that need support are in behavior. Families may need a behavior specialist, such as a BCBA, to address temper outbursts, aggressions, and self-injurious behaviors. Sleep patterns. Because individuals with SMS prefer to sleep during the day and stay awake at night, parents and siblings' sleep patterns are altered as well. Medical needs. Families need to take time to find medical doctors and specialists in vision, hearing, heart, and physical therapy. Adaptive skills. Teaching skills and adaptive skills such as dressing may involve all family members. What are the possible educational adaptations to support academics, communication, social, behavioral and emotional, and self-determination skills? You can provide a structured environment and predictable routine. Present tasks clearly by giving simple instructions. Use visual cues like pictures or words to illustrate daily activities and schedules. Use technology like the computer and iPad to pre-teach skills. Use rewards, such as increase social time with preferred adults and peers. Use timers. Provide breaks and allow sleep time or nap time. Give choices to increase communication and self-determination skills. A team approach should be utilized and practiced. Teams can consult therapy specialists in the following areas, and not limited to speech and language, occupational, physical, and orthopedic therapies. You may also want to consult with a behavior specialist, like a school psychologist, to discuss a behavioral intervention plan. You may also seek support from other providers, such as the workplace and residential. For more information, please visit these websites. Further inform neurogenic disorders or find. Parents and researchers interested in smith-magenis syndrome or PRISM. Watch a YouTube video, Rare Disease Day, Smith-Magenis Syndrome, 2011. And finally, visit this website, Smith-Magenis Syndrome Foundation, UK. References. Thank you.